Good day, friends. So I'm going to discuss a case that was referred to us. It's a 50-year-old lady with right-sided pain and presented with a pseudo hernia. And on workup, it was found that she's got a T1011 disc herniation foraminal. And we can see the MRI scan here as we scroll through the axial, sagittal, and coronal cuts. And we're also going to have a look at the CT scan, and we can see that it's a calcified disc. So it was a little bit strange with the acute onset of the severe pain in the hernia. The patient was booked for a UBE discectomy. So some of the challenges that we need to perhaps discuss with that is that it's a right-sided disc. Although I'm a right-hand dominant surgeon, I do prefer to keep my camera in the right hand and work with my left hand when addressing right-sided pathology, as can be seen on this docking x-ray. Here we have the lamina exposed, the lateral aspect of the lamina, and I'm just clearing up the soft tissue onto it and getting my bony landmark. So I'm going to take the diamond drill and going to drill the lateral aspect of the IAP, and the white that starts appearing is the joint line between the IAP and the SAP. And very much like with the paraspinal approach, we want to expose that SAP triangle especially, because that's going to be our key to the doorway, and it's going to provide us a very clear anatomical landmark to the foramen. So here I'm starting to probe under the SAP. Foramen is extremely tight, difficult to get in because of that disc herniation, and I'm undercutting the SAP, exposing the flavum, and by gently removing soft tissue we're able to expose the nerve root, and we'll see in a second the disc herniation that I've dissected free. And here we can clearly see that very pale nerve root DRG, and there's no pulsation in that nerve root. So I'm entering into the disc with the Indian knife. I prefer a nice, fairly blunt knife for these entries, and then just taking a curette to get this hard calcified disc material out, and basically just working that space between a rhongia and a curette to decompress the foraminal area. Then gentle hemostasis, and we can now start seeing under the nerve root into the dural space. We can see the nice happy free dura that's pulsating, and the color of the nerve root has come back. It's starting to blanch red, which is a good indication that the decompression is actually successful. And then just with gentle palpation we can make sure that the last of the nerve root is completely free, both posteriorly and anteriorly. Thank you very much for watching.